Okay, hello. It is John Smith here again, and I haven't been updating. We had a 2 day power cut here. Power went out for 2 days, and I had been remarkably busy. I've also been watching the things unfold recently. There wasn't anything major, I don't think, in the last 2 to 3 days, other than today, which is a big step forward. Um, Today, so let's just go ahead and write some key points here. The World Health Organization has finally declared that it's a pandemic. Finally! Now, on the other side of this, other than actually admitting this is a pandemic now, it's been a pandemic for weeks, but okay. They are saying that we still have time to contain this, which is BS. Cannot be contained at this point. There is no point in trying to contain it now. We have a complete disruption of in the United States. We have a disruption of many different things going on in the United States. For example, different states are having a different idea how to deal with this. For example, some states are declaring it an emergency. Some areas and cities are basically saying no gatherings at all over 250 people. And then on the other flip side of it, there are a lot of games being cancelled, or the sports games that are going through are being done without allowing the public in to watch the games, to spectate it in crowds, which is good, because that's just how this thing's going to spread so fast. Chicago has cancelled its St. Patty's Day parade and the filling up the green, whatever they do with make the river green, with their dyes and whatever. Cancelled that and the parade. So Chicago cancelling events, good thing. And then we have, on the other side, we have a game going on. I think it's a basketball game. I'm not exactly sure what sport it is. Whereas they say they're not cancelling it and they're not preventing crowds from attending. So then we have like a disconnection of agreements on what to do. And then we have other reports that some schools are closing down, but there is information coming out that they don't need to close schools yet because there are no cases in certain locations yet, which is actually it's reacting to what's going on. And instead of like preparing for this whole thing, we need to prepare for it now. The whole country needs to prepare for it. We still have people making comments on all over the place, on Facebook groups, on YouTube videos, saying that it's just a flu. No, it's not just a flu. And then we have other people that are saying that they are still going to travel no matter what, because you only live once. And they aren't going to let anyone pretty much a bunch of quotes going around that are very much like this. Yep. What to say? So the biggest event was, as I said, the World Health Organization finally getting their heads out of their asses and declaring this a pandemic. it's been a pandemic for a while. It's a little too late, I say, to declare it now, but I think people are now starting to realize. There are news sources are completely segmented, or should I say disconnected, between each other with different ideas. For example, like kids should stay home from school or kids shouldn't, and all that. And then we have the universities closing down for a month, good thing. And then we have other universities not closing down, and then we have children still going to school right now in areas that have it. In Chicago, ridiculous. Chicago is now going to become a hot zone. I'm pretty sure about it. I believe that the R naught is actually higher than what is being reported. I'm starting to believe that the R naught is more about 4 plus. So for every one person that is infected, they will go on to infect 4 other people. And then that 4 other people will go on to infect 16. So it's this is how things develop, right? This is how they grow and develop. So it starts off with a few cases and then it explodes. Like, it's not going to be like there's 1,000 cases and then it's going to double to 2,000 cases. Okay, if the R naught is 4, then there'll be 1,000 cases, and then it will be 4,000 cases, and then 4,000 cases will then go up to 16,000 cases. So it doesn't just grow or double each day, but we are seeing some trends of that happening. Right now it's due to underreporting, whereas things, once they start to double in the reports of people that are infected on a daily basis, you can pretty much ascertain that it's probably spread about 4 times more than that. Or, well, it's spread a lot more than that. Could be lower or could be higher. Depends on the type of community involved. I've been going on about the people are separating the active to the closed cases. They are different areas of case study, but the active cases are going up and the closed cases are going up too. The number is getting closer together. I predict that when this number equals the same number as the closed cases, then we're going to have a serious problem. Okay, I think that it's possible theoretically to contain this while the active cases are still lower than the recoveries. But I do believe that once it becomes a 50-50, or 50% people recovering and 50% people infected from the cases combined, that we are going to have a huge problem containing this. And I believe that is the point of no return of even containing it anywhere. So once this equals each other, then containment is gone. Mitigation and delays should be what will happen after. The mitigating the damage that is done through this to lower the infection rate or the attack rate lower than a massive number. China is still reporting, they're still having deaths, it's a slow process, they're still quarantined. They say they might lift the quarantine. Was it May or April? I think it was May. By that stage, the world's going to be pretty much effed. So lifting a quarantine at that point it's not going to do any good, because they're just going to get the rest of China is going to get backflow cases, and it's going to explode in different areas in Wuhan and Hubei. Italy has a high number today because they misrepresented their cases yesterday. They didn't report the cases all yesterday. So I did mention yesterday the cases were low for Italy, and I knew it wasn't that. So they're adding the cases on today. So that's probably around 1,700 today. Still a big number. Iran, still pretty bad. We know it's worse than that in Iran. The people who have been making comments in Iran, I've been reading comments. The news coming out of websites in Iran shows a much darker picture than what is being reported. This new cases number is probably in the thousands, probably 6,000-7,000 a day. I believe it is a lot higher than that. I'm thinking that there might be around 50, 60, 70,000 in Iran right now of infected people. South Korea is actually, I'd say they're not doing so well. I mean, their numbers were going down, and then it's a slight worry. I mean, their daily cases went down and then down for the TEP, and then it's gone up again. So 272 was like 3 days ago, and today is 242. So that they're handling it, but it's not exactly like China was. You know, it's not going down in that level, so they're still having infections constantly. France, not doing so good. Spain is now probably going to become the next hot zone, or another epicenter of the virus that will be coming out. There it is growing ridiculously fast for when it was first reported. And you can see here Spain's growth has exploded since the 5th of March, which is 6 days ago. Has exploded. That is going to be a problem. Germany, still relatively new cases, so there are not many deaths yet, but they will start dying as the week goes on when the virus starts killing people. USA, I'm so sick of this misrepresenting the whole this really pisses me off. Like, I am so mad at this. 8,500 tests done total, whatever that is, something like that. And yeah, over 10%, more like 14% of those cases are positive out of the tests done. 115 is such a misrepresented number so far. I don't know why they're not reporting throughout the day now. They were. But if this number does not jump up to 1,000 by the end of the day, then the United States is in such denial and misrepresenting their cases, or just not doing enough tests, or whatever is going on there. Or should I say here, is just silly. This number should be over 1,000 already. The United States is bad, and it is probably more equal to Iran right now. I reckon there's probably around 60,000-70,000 people infected in the United States right now. That high. And I'm being serious. Okay, there is such a misrepresenting of the tests done to case it, well, not of the actual amount of people that are infected. It's not doing enough. The US is not on the ball game, and it is a problem. So we can see here, this is not even the end of the day yet. We still have more numbers, probably around 500 more. In the United States, when it reports, I should hope it should report about 1,000, so we can take a little looky at what's going on here. We're at 6,719 today. Deaths 333. We're going to look at that in a minute and see the difference in the changes from yesterday and the day before. This should be about 8,000 by the end of the day, which means that it almost doubled in a day of reported cases. Eventually, it's going to hit 10,000 maybe by the end of the week, 10,000 a day. And then we're going to look at China real quick. So let's say 10,000 a day, in 10 days, 100,000 people. It's actually, if it only got 10,000 a day for 10 days, it's going to go from 10,000, then it's going to go up the next day, and then it's going to go up the next day. So it's not going to be 100,000, it might be 200,000 by the next 10 days. More cases in the rest of the world other than China. But let's look at China, for example. They're at their worst. This is hard because this is like a clerical thing here. This is sort of reporting that was just the way they started documenting things have changed. But I'm going to say that China would... this is daily cases. Let's look at China. Let's go ahead. Focus more on China. I'm going to go back here. I'm going to click on China specifically so I can actually see what was going on within China. Their worst was these two... so maybe the number highest was here, which was 3,000, probably around 4,800 was their highest on a day. So yeah, if we spread out this, number, then we probably have a huge amount of issues going on here. They were right for, like I said, 4,800, let's say, was their highest peak, and then it went down. So, and then we look at the rest of the world. We're going to go ahead and look at the rest of the world now. Just, oh, not the cases, go back. Look at the, oh yeah, sorry, more case statistics, I was right. And since China is brought in is such a low number, it was 4,567 yesterday. Now it's going to be probably 8,000 today, meaning that it has a biggest explosion. And China was, it didn't take China long to reach 80,000 cases or whatever it was. So expect, if it goes from 8,000 today and then 10,000 tomorrow, let's say, and then 12,000 the next day, maybe 16 the next day. I don't know what it's going to be. I can't predict that exactly. But we are looking at a faster growth around the world than China had. And by the end of the next 10 days, it probably is going to be double what China had in terms of spread. Not looking good. I'd say at the end of the month, definitely over 500,000 people infected, more closely to 1 million. And it's going to keep growing and exploding on growth very fast. Now, the director of the National Institute of Allergy and Infectious Diseases, he said things will get worse. He's finally not downplaying it like he was a week ago. And then he was asked about how many estimated fatalities in the United States. He said, I can't give you a number. He said, I can't give you a realistic number until we put into the factor of how we respond. If we are complacent and don't do really aggressive containment and mitigation, the number could go way up and be involved in many, many millions. Now, this is on the subject of the United States. I have been saying by the end of the year that we probably will have millions of United States deaths. I'm thinking about 9 million people might die from this. And it's good to see that, some officials are actually recognizing that number. Now, we are being complacent, so I don't know if we are complacent. I don't know what's going on with that. We are extremely complacent in this country right now. And it is a cluster F. No one is doing enough to prevent this from transmitting. So I'm not sure what to say about that. But it's nice to see that predictions are being recognized more now. And yeah, I can see this as being a bit of a catastrophe. So let's say that in the whole world, let's say that let's say about 900 million got this. Okay, and let's say that we have, right now it's a 3.6 case fatality rate. Let's be fair and say it drops down to maybe 1.5%. Well, actually, let's just cut that in half. Let's say 1.8%. Is 16 million or so people could die if there's only 15, 20% or less of people that are infected across the world. Now, let's say that 5 billion people, which is the estimated the amount of people that could be infected from this. So let's say a 1.6% of that, 80 million people potentially could die from this pandemic. Yeah. So it's not small. I'm telling people this now. This is going to be one of the worst pandemics in the last 100 years. It's going to be worse than the Spanish flu. And people might not believe it because they so hold on to what they are doing, like, oh, we're in 2020, it's not going to affect us like it did in 1918. And it's just, it's people just aren't taking it serious enough. They think they somehow are immune to it, that the healthcare industry will fix them. Now, we know a vaccine is over a year away. There might be treatments for this which might mitigate the amount of deaths. Now, treatments could be certain antiviral therapies that are done. There is promise that, coronavirus is still a virus. Or should I say the SARS-CoV-2 is a virus. It's still susceptible to certain treatments. Now, some treatments might work and some might not, so it might be in a few months that we might have a way to mitigate the deaths and cut that in half, which will be good, but it's going to be a problem getting that round drugs into the third world once that gets destroyed by this, because unfortunately there might be the other problem with the cost of drugs. There might be a treatment for it and hospitals might bill $10,000 just for the treatment, and people are just going to die because they choose not to get the treatment because it's too expensive on them. It's I don't know what to say. I think it's going to be bad, but I think that there might be some mitigation strategies down the road that will lower the death rate to lower. So 3.6% right now might drop to 1.5% or even to 1%, which is still bad. That's still 10 times higher than the seasonal flu. So I have a saying here, and I've been saying this for a while now, and that is this. And I've been saying this for a few weeks now, just to try to get this into people's minds that aren't. I know it's not exactly. It's comparing apples to oranges, but this is a good way to get the information into the denier's heads that this is a problem. So, if 3.6 people are dying out of 100 people, okay? Then, if you drove to work every day for the next 100 days, and if you were told that within those 100 days you're going to die, this is if you are infected. Okay? So So if you come down with this infection and you drove to work for the next 100 days, or you stayed home, for the 100 days, yeah, you're gonna die 3.6 times. If you had the infection for 100 days. Okay, now I know it's not really a good way to compare because the infection only lasts around 15 days or so. But if if you even lower that from 3.6 to 1 day, you have one, you're gonna die once in 100 days. It's still not good. If we take let's take a look at this. If we if we take okay, so we have almost 1% out of 100% chance of dying. It's just it's pretty enlightening when you think about it. You know, it's just if your family were infected every 15 days or so, let's say you're infected, your spouse is infected, your grandparents are infected, then you have a chance that over that course one of them is going to die. It's most probable that someone is going to die out of that group, and people need to take this seriously to protect their loved ones. So that's all I really have today to update on. I'm really depressed at the way I mean, if I refresh this, let's see what's added here. We might see some lack of reporting all throughout the day. Very depressed about that. I think people need to be more aware. And yeah, that's it for now.